You are welcome to Graceland Diabetes Foundation, an international diabetes educators, reaching out to people in United Kingdom, Africa and the world at large. In today's episode, Mr. Peter, from Graceland Diabetes Foundation, shall be talking about the risk factors of type 2 diabetes. You are welcome, Mr. Peter, to today's episode.
It's my pleasure to be with you today.
The floor is open, sir.
Type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar, glucose, an important source of fuel for your body. With type 2 diabetes, your body either resists the effects of insulin, a hormone that regulates the movement of sugar into your cells, or doesn't produce enough insulin to maintain normal glucose levels.
While I was going through an article online, I found out that diabetes don't only affects the old, but newborn babies and young adults too. Is it true?
Yes, it's true. Type 2 diabetes used to be known as adult-onset diabetes, but today more children are being diagnosed with the disorder, probably due to the rise in childhood obesity. There's no cure for type 2 diabetes, but losing weight, eating well and exercising can help manage the disease. If diet and exercise aren't enough to manage your blood sugar well, you may also need diabetes medications or insulin therapy.
Kindly tell us the exact factors that may trigger this diabetes.
Here are the risk factors for type 2 diabetes. Average age for diagnosis. The risk of type 2 diabetes increases as you get older, especially after age 45.
How?
That's probably because people tend to exercise less, lose muscle mass and gain weight as they age. But type 2 diabetes is also increasing dramatically among children, adolescents and younger adults. Another risk factor is overweight. Being overweight is a main risk factor for type 2 diabetes. However, you don't have to be overweight to develop type 2 diabetes.
Does that mean being overweight is risky?
Exactly. Next is fat distribution. If you store fat mainly in the abdomen, you have a greater risk of type 2 diabetes than if you store fat elsewhere, such as in your hips and thighs.
So people with protruding tummy or pot belly are also at risk of diabetes.
Your risk of type 2 diabetes rises if you're a man with a waist circumference above 40 inches (101.6 centimeters), or a woman with a waist that's greater than 35 inches (88.9 centimeters).
I think I will need to make this information go viral.
Please do. Next is ethnicity.
How does one's ethnicity increases the risk of type 2 diabetes?
It's unclear why people of certain races, including Black, Hispanic, American Indian and Asian American people, are more likely to develop type 2 diabetes than white people are. Another risk factor is history of gestational diabetes mellitus. If you developed gestational diabetes when you were pregnant, your risk of developing type 2 diabetes increases.
What are the risk factors to check here?
If you gave birth to a baby weighing more than 9 pounds, 4 kilograms, you're also at risk of type 2 diabetes. Lifestyle related. Type 2 diabetes is often lifestyle related and the risk factors are physical inactivity, hypertension and depression. The less active you are, the greater your risk of type 2 diabetes.
This is insightful.
Physical activity helps you control your weight, uses up glucose as energy and makes your cells more sensitive to insulin.
Does that mean physical activities, like swimming, jogging and skipping, can help reduce the risk factors of type 2 diabetes?
You are correct. Next is high-density lipoprotein cholesterol. HDL-C level greater than 35 mg can be a risk factor to the development of type 2 diabetes. Next is triglyceride level. People with fasting triglyceride level, greater than 250 mg, can be affected as well.
This is informative.
Next is polycystic ovarian syndrome.
Explain this please.
For women, having polycystic ovarian syndrome, a common condition characterized by irregular menstrual periods, excess hair growth and obesity, increases the risk of diabetes. Next is insulin resistance.
Please can you explain this?
Oh yes. People are more likely to develop diabetes if they have the following conditions: acanthosis nigricans, non-alcoholic steatohepatitis and other conditions associated with insulin resistance. Another serious risk factor is sleep deprivation.
Break it down please.
Obstructive sleep, or sleep deprivation less than 6 hours per day, is a great risk factor to type 2 diabetes.
This is serious. Does that mean having sleepless nights is a risk factor to type 2 diabetes?
The answer is yes, if it's frequently. Next is prediabetes.
What is prediabetes?
Prediabetes is a condition in which your blood sugar level is higher than normal, but not high enough to be classified as diabetes. If left untreated, prediabetes often progresses to type 2 diabetes. Next is family history. The risk of type 2 diabetes increases if your parent or sibling has type 2 diabetes.
This is understandable.
This is all for today. Thank you for watching.
Thank you, Mr. Peter, for this wonderful lecture.
You are welcome.
Life has no duplicate, we must take care of the one we have. This episode was brought to you by Graceland Diabetes Foundation.